I want to share the case 2. I think here. It's a female type 2 diabetes with a long history of about 15 years already, but the blood glucose control is poor. So at the very beginning, he used the oral drug, metformin and acarbose combined, but blood glucose is rather higher. Then she started glargine injection at that time, but not quite well, even with the DAPA, and he suffered the hypoglycemia. And anyway, he used the metformin plus the repaglinide with the glargine altogether. So this time he suffered hypertension, coronary heart disease, and here the past history, no instruction, no history of the coronary heart disease here. No special for the personal history and family history. Yeah, it's typical diabetic history here, brother and sister or diabetes. Laboratory data you can see from here is with the GFR a little bit lower, and with the hyperlipidemia and the rather higher fasting blood glucose and postprandial glucose. No detail of HbA1c. So here is the examination. They should accelerate. The answer is AI doctor. So you can see the answer, the score almost 10-10 exactly. The insulin function, the pancreas function is typical. I think it's typical of type 2 diabetes with the gut, and the other antibody is negative. So here from the urinary UACR, you can found she already suffered of diabetic nephropathy with the atherosclerosis, and for the carotid arterial and lower extreme arterial, and also it's typical fundus photograph of diabetic retinopathy. The other examination is the liver, fatty liver, and coronary CT agonist argograph is positive, but the ECG is sinus racing. So from the answer, the first doctor is an AI doctor. I judge for even the diagnosis is very formatted, I think, from the type 2 diabetes with the older microvascular complication, exactly. And the other is about the coronary heart disease and hypertension, hyperlipidemia, hyperlipidemia, sclerosis, liver, fatty liver, even with the gastro ulcer. Here is the answer, almost the same for the answer, almost the same. Even the doctor's instruction is also very format, I think. Anyway, she would select the metformin as the first line, and with the repaglinide, but the dosage a little bit lower than the original one, combined with the LIRO, so GLP-1 receptor, maybe decrease the opportunity of hypoglycemia, I think. The other is for the anti-hypertension, anti-hyperlipidemia, and for the cardiovascular disease and so on. Almost all the treatment of all the diagnosis disease. And also the following suggestion is very exactly in detail. So it's the answer from the AI doctor, I think. The other, the third doctor, not the AI doctor, the only no diagnosis of obesity is because the BMI is over than 30. Here, BMI more than 30. So the common is the no diagnosis. So the score is a little bit not 100, I think. The third doctor is not too bad. So you can see from here, the examination and the history, medical history inquiries almost exactly of the answer. Also ask the history of thyroid disease and osteoporosis. So from the diagnosis, you can say yes, a little bit the little bit different from the major and the second diagnosis. Anyway, it's almost exactly the answer, only for the stage is not exactly. So for the doctor's instruction here, they only used metformin with GLP-1 receptor. Maybe it's not exactly can control the blood glucose, I think. The other one is here, no aspirin, no diagnosis of diabetic periphery neuropathy, and no treatment of this and DR. So maybe it's a little bit a lower score for the third doctor. That's all.